Welcome to Enhancing the Human. I'm Dr. Jena, a renowned expert in the field of human enhancement. I've spent decades of my life exploring all aspects of human health, which has allowed me to take people from extreme injury and disability to peak athletic performance. I use cutting-edge advancements, breakthrough technologies, and scientific insights to push the boundaries of human capabilities. The human body is able to do so much more than you think. Let's start enhancing the human. Hello, and welcome to Enhancing the Human podcast. I'm your host, Dr. Jena, and today is honestly one of our most interesting episodes yet. Today we speak to Dr. Petrigliano. He is the sports orthopedic surgeon for the NHL Kings, and he was recently voted one of LA's top doctors in 2023. We discuss his professional athletes as well as his stem cell therapy research he's using to pave the way and revolutionize muscle and cartilage injuries. But what else you said? Go ahead and finish what you do with the Kings. You said that they.
Oh, so you use black and white segments, and it's usually talking about specific injuries, how they were treated, what the recovery was like, and we try to make it approachable to the fans. So they can get a little bit of an insight of what we do for the team, because they don't even realize it's not just me. So I'm there, but then we have a traumatologist, ER doctor, plastic surgeon, dentist, primary care doctor, and on the peripheral, and they're at every game. And on the peripheral team, we have like a dermatologist, and then
That's so good, though. You think about all those things.
well, the players get first class care.
Yeah.
And if they get hurt on a Friday night, they're seen that night and then referred to the specialist on a Saturday morning. So they've got full like
Coverage,
concierge care for all their injuries. But we've extended that to the Kings family, like the people that work in the office,
Yes.
AEG, which is the parent corporation. They all have that. But going to the games it's a lot of games. You got to cover 42 home games. I split it up with 3 of my partners. We divvy up the games, which makes it a little bit more manageable. But you have to have fun there, or you lose your mind. I mean, I love hockey, and it's still, you'd go nuts trying to watch that for that amount of time.
Right.
So I've gotten to be really good friends with the other doctors, their families.
Got it. There's someone training right now, I think, at your facility or at their facility, and they have a gym.
Yes, we're partnered. So
Yes.
I work for USC. We have our clinic in the facility. And then we partner with Meyer Institute for Sports. So John Meyer and Lisa Meyer, they are physical therapists, and they had a little bit of their own shop near the airport for a while, but they started doing some work for the pro teams like the Clippers and the Kings, and they were really happy with their rehab. So then when the Lakers moved out of the Toyota Center, they offered that space to them to start their own shop. And since they had both gone to USC, they said, we want to partner with a medical provider. Let's look at USC. And USC was expanding. I was still at UCLA at the time. And they said, all right, we're going to do this partnership. We'll have a physical therapy and rehabilitation facility, but we want to partner with a medical clinic. And that's when I got recruited over to run the medical side.
Amazing.
And that was 5 years ago. And it's a really, I think, special environment to treat patients, because you see them, you prescribe either PT or surgery, and they're going to need PT after surgery. But then if they stay in-house, you're able to follow them throughout their whole recovery, right? You walk next door and check in on them.
Yep.
So for the players, that's a given, right? So if I operate on one of the Kings players, they practice, train, rehab all in one spot. And it's awesome because I get to know the players really well. I know if they're actually improving. Like some patients come in to tell you, I'm doing fine.
Yeah, and they're not
And
doing
you're
anything.
like, you sure? With the players, I know them pretty well now.
Yes.
I know their personalities pretty well. So I can tell if they're actually thriving or not. And then John and Lisa have a wonderful physical therapist there who are really are proficient at dealing with both professional athletes and just weekend warriors.
Right.
And the patients feel like they're getting world-class care. and then they know that you're monitoring them too. So
Right.
they
They care
really want to
more.
work hard. And the funniest thing about that facility is will have professional athletes training with like grandmas.
Yes.
Like
That's
they
the
like
best.
this lady had a knee replacement. This guy had a cuff repair, and he's going to go back and play, professional baseball. And she just wants to be able to walk down the strand without pain. But they kind of like inspire one another, which is
I
pretty
love
cool.
that. And you kind of see both ends of the spectrum,
Yeah.
and like where you could be. I guarantee that's got to be motivational to see someone that at that age have an injury and you're younger and you're like, maybe I should step up my game.
Well, I think that's what is special about that kind of reinforcement is the young guy or young woman looks at the older patient like I if they can do it, I can do it.
Right.
And the older patient like, oh, this is just cool that I'm working out with these
Right.
young people. This is fantastic.
And it gives them adrenaline, I guarantee you, to like, oh, I'm hanging out with these young
Yeah.
whippersnappers. That gives them motivation. They
And for
feel
me,
young.
it's cool because, like, obviously, I deal with a lot of the hockey athletes, but John and Lisa have a lot of NBAers, NFLers in there, and I don't know, it's still kind of neat. I
Yeah.
still get starstruck, like
Fun.
even at this phase when I see like some, you know, world known basketball player or something that you wouldn't see on walking down the street.
Right.
And they're pretty chill. Like it's a very like low key environment, and people don't feel like so entitled that they have to work out in some special area where no
Right.
one's going to see them. It's
More
like,
family, I feel.
yeah, I mean, it's just like everyone's kind of working out together. They're
Right.
sharing the same resources, so there's no pretension,
Right.
which is I think one of the coolest things about it. And hockey's sort of like that in general. So I think that's bled over into the rehab side of things too.
It's not every sport is like that.
No, like there are a lot of sports where people travel with their own like
Everything.
team.
Yes.
So not only does the team have a head athletic trainer and a strength and conditioning coach and a massage therapist, the athlete has that as well. And then you've got to deal with the organizations, the sports medicine team.
Oh,
But
yeah.
then they've got their own sports medicine team. And then if you've got a couple of superstars, they may have like multiple entourage going on. So
different states too.
it's a lot of stuff.
A lot to deal with. But I feel like that's good though, because NHL, I feel like it's more camaraderie than, I mean, NASCAR was the same way, but the drivers were very separate from the pit crews. It was like a whole different world, and the drivers had their own people too, but also used the team people. So it's just interesting. Very interesting. I think I have a UFC fighter that works out there, Brian Ortega.
Oh, yeah, yeah.
Yeah, so he's coming. He's fighting soon, I think in a couple weeks. So it's fun to watch them go from injury to set them out into
the wild.
I call them my motocross guys would like shatter their heels and then they're like, can you come ride with me for the first time? And so I'd go out to the track with them and they're like your little baby bird that you're like,
no, getting to see people get back is incredible. And one of I think when I started doing this, which is, 15 years ago now, it was super anxiety inducing to like operate on an athlete who's then going to go test that repair
to the max.
Right. So for the first season, you're just holding your breath, just waiting for them to re-injure it.
And having to go to the games, you're just watching them.
Yeah. I mean, like one of my first big surgeries that I did at UCLA was like on an Olympic gymnast. And it was a revision of a previous surgery. And she went on to win multiple gold medals, but it was like terrifying to watch her test.
Can't even imagine
that injury.
And you don't even know if it's a re-injury. So you don't even know what has been done before that. So you're cutting open. You don't even know what to expect.
Well, their confidence is crushed, right? Because they've already had an injury.
Yep.
And then their trust in the medical system is a little bit diminished, right? Because someone else has told them, oh, you're going to be fine. And then they weren't. So then they're looking at you like, why are you going to be any different? Like, why is this going to turn out any differently? So I'm sure you found this in your career, but half of what you do, if not more, is just the counseling and the hand holding and
more
building confidence
and trust.
And
I feel like that's why I like to highlight people like you, because you care about people and you try to give the person what they need individually, to help them And from a long-term perspective, I feel like you're not just a quick fix type of person. You're trying to look at longevity and a lot of the research you do too. I think that's so fascinating. So tell us a little bit about your research, the stem cell stuff behind what you do. How did you get into that? Just researching it and figuring out you can grow things from different tissues and
Well, it's kind of interesting. So when I was a med student, I was trying to find a job for the summer with somebody who did research, right? Because to get from medical school into residency, you need to build your quote unquote research portfolio. And so this is a very common thing that people do now, but in the past, they didn't. But I took a year off. I worked at the Hospital for Special Surgery in New York with somebody who's like the Giants team doctor, who's like this guy Russ Warren, who's really like one of the giants in the field. And it was the beginning. I remember it was the beginning of email. So I was emailed like 20 doctors, and probably like 2 people responded to me, and one of them was Russ Warren. And he's like, "Oh, I've got a project for you." And he invited me into New York. I was living in New Jersey at the time. I met with him and his junior partner, Riley Williams, who was like just fresh out of fellowship. And they were doing cartilage regeneration research. And Dr. Williams was very excited about trying to build new cartilage. And there weren't really many options at that point. And so I got assigned this summer job doing work in the lab with him, basically trying to grow cartilage. And I was like, oh, this basic science stuff is pretty cool. I mean, I want to be a surgeon, but I'm also really interested
so
in
cool.
like the development and discovery portion of medicine, which is distinctly different than the operate, fix, and then send somebody off to their life afterwards aspect of medicine. So when I matched at UCLA for residency, they have a research track where you can take more time off. And I worked under 2 very good mentors there. One of them was studying ACL regeneration, and one of them was studying bone regeneration. So I developed a very strong background, even as an orthopedic surgeon, in the basic science techniques necessary to study these things, but also how to develop questions around what is the best way to utilize stem cells, et cetera, to make new tissues. I got really into bioengineering. I came back after fellowship to UCLA and I started looking at the regeneration of ACL tissue and also muscle regeneration. And, what we know now is that this type of muscle regeneration, ligament regeneration, cartilage regeneration is going to be the future of
Health.
just, musculoskeletal health, right? So there's only so many things that you can fix with surgery, but if you can build new muscle, build new bone, build new cartilage, ligament, et cetera, to replace damaged tissues, it's very exciting.
Right.
So I started looking at ways that you could use these things called perivascular stem cells, which are around blood cells to regenerate muscle. Because a lot of what I deal with is shoulder injuries. That's probably about 60% of my practice. And if you tear your rotator cuff, the muscle degenerates, and there's no way to really restore that, even if you fix the cuff. So the question I asked is, okay, what if you had stem cells that could regenerate muscle indefinitely and implant them into an injured rotator cuff and regenerate that muscle? Would it help? So we started looking at first at a very basic level in cell culture. How do you regenerate rotator cuff muscle in cell culture? Then we moved it to an animal model and started creating an injury model in the animals and regenerating the cuff with these stem cells. And then we moved it into a human model. And it took many years to get there, but we're starting to look at ways of regenerating muscle in humans now after massive, not only rotator cuff injury, but just massive muscle injury. And that was one line of work that I was interested in. But then I got partnered with another MD PhD, Denis Evzenko, who's really a world expert in stem cell biology. And he walked into my office and he's like, in a very strong Russian accent, he's like, Frank, I'm going to cure arthritis. Like, can you help me with this? And I was like, okay, Dennis, sure, no
No other
problem.
preface.
I was like, yeah, sure.
Yeah, let's go.
Help curing arthritis sounds great. But he had a very logical way of approaching just cartilage regeneration in general. So he outlined how cartilage is developed from a fetal state and followed it step by step, week by week, and looked at the growth factors that are elaborated in a fetus. And like, so how does this developing organism make cartilage? And then when you injure it, when you're older, why doesn't that happen? What growth factors are missing, et cetera. And we had a great team. We had UCLA med students and postdocs all kind of looking at this question. And basically, what he did is outline the roadmap of how can you take stem cells from a pluripotent stage, from the very earliest phases of development, and push them towards
Certain
mature
muscle.
cartilage. And from that, mostly he, but I've helped on the clinical side, have developed two different technologies. One is a scaffold that has pluripotent stem cell derived cartilage cells. So basically, these cells that have been pushed from a pluripotent state where they could become anything
Right.
into purely cartilage cells, but young cartilage cells. And then we seed those onto a scaffold. So if an athlete has a hole in their articular cartilage, which is the weight bearing cartilage on, say, the knee or the shoulder, we can patch it with this device. And it
So
has
you grow it outside and then put it
exactly.
within.
It's
Oh,
put
that's
onto a
so
scaffold.
interesting.
And the reason it's so, I think, appealing to surgeons is because what is available now is very limiting. You're either using cadaver cartilage, or you can use a patient's own cartilage, but it's their old adult cartilage, which is grown in the lab, which is not great. So these are kind of like juvenile type cells that are put onto a scaffold, and they can be used to patch articular cartilage defects. And if you can stop those defects early on, maybe they don't develop into osteoarthritis. So this work has been supported by CIRM, which is California's Institute for Regenerative Medicine. And this year we'll be filing an IND. That's an investigational new device application with the FDA to do a phase 1 clinical trial,
Amazing.
which is purely a safety trial. So like you get 8 patients who volunteer for this. You put the implant in, you make sure nothing crazy happens, basically. And it's been safe. It's been safety tested in animals and in the lab. You still have to do it in people in a small group, and they have to know what the risks are. But that would be like a dream come true for me to get that into a clinical trial. Because one, it's the collaborative work that we were discussing, where you're
Yes.
working with this team of people that you enjoy working with, you respect. Everyone's got different skill sets, and you've worked as a team to make it happen. And I think you could, if it actually goes to market, you'd be helping, where as a surgeon, you can help a few people a week.
Right.
You could help tens of thousands of people if that thing works.
And I feel like people don't know a lot about cadaver. Using anything cadaver, your body can reject it, so it's not always a for sure thing. And especially with anything, your body can reject it. But from a longevity standpoint, if you're fixing the cartilage, you're not going to have breakdown in the joint. You have to
Mhm.
have less replacements. People don't realize either that you can only get so many replacements,
Right.
especially the shoulder.
Shoulder, knee, hip. I mean,
Crazy.
basically you get one great one,
Yeah.
and then if it wears out, the revision surgeries are not as predictable.
Especially with the shoulder, correct?
Mhm.
From the last time I looked.
Shoulder is probably has the shortest track record because hip
Got
and
it.
knee has been done for a lot longer,
Got it.
but we're getting a lot better at shoulder replacements too.
Good.
The materials are better, the plastic that used as the weight-bearing portion
Mm.
is better as well, and we know how to counsel patients appropriately. And I actually let patients do whatever they feel comfortable doing, but they need to know it's an artificial joint. It's not gonna be exactly what they started out with, not their natural parts. The toughest group of patients that I deal with are not the people that actually need joint replacement. It's the people who are in this purgatory of they have an early arthritic condition. So they've had some damage to either their hip or their knee. In my case, a lot of time the shoulder joint, too young or not enough arthritis for a shoulder replacement or a knee replacement, but they need something done. And the minimally invasive surgeries like the scopes, they may not provide pain relief because you can't change the cartilage. It's just worn down. So that takes me back to like this other project we were doing with Dr. Evzenko, which was developing small molecules for injection that can slow down cartilage wear. So this was another thing we started back at UCLA. We had a postdoc who was really interested in looking at libraries of small molecules. And I was like, what the heck is that? He's like, well, they have all these molecules that have some biologic effect, but not patented. You can screen them and figure out if they do something for the disease you're looking at. Dennis and I were like, oh, arthritis. Let's figure out if any of these things slow down arthritis. So our student, Jacob Bogdanov, I still remember him very well. He's like, oh, I can do this. And it took him a few months, but he basically screened two or 300,000 molecules against arthritic change. And we found like a couple hundred that were candidates. And then we narrowed it down and we started looking at these small molecules in small animal models of arthritis. And lo and behold, you injected the animal with this molecule after you induced an injury, it really slowed down arthritic
That's so interesting.
change. We're like, all right, we got something here. And we applied for another CERM grant for that. And that was funded. And basically, we took that small animal model and then we used it in bigger animals. And we found that it same effect in them as well. And now we're approaching another IND application for that um, molecule. It's called CX11, but there's different analogs of it. And if this thing works, it'll be one of the first disease modifying drugs against osteoarthritis. So there's lots of drugs for rheumatoid arthritis. You know, if you have bad RA, they can give you Enbrel or something and it really slows down the disease. There's nothing like that for standard osteoarthritis. And there's been a lot of different medications that have been submitted to the FDA and they get through phase 1. And then once you go to an efficacy study, they find out it's safe, but it doesn't really do anything to modify the disease. So we're going to have that hurdle as well. But the data is very, very promising. So once we get through this funding phase, then we're going to move into an IND phase. And then hopefully we'll have a phase 1 clinical trial in the next year or so. And so that's 2 biologic products that have come out of the USC/UCLA labs, and both very, very exciting for an orthopedic surgeon to see, because usually we're not on the discovery side. We're on the cutting side, or maybe you develop some implants or something, but to do real disease modifying work is super exciting.
And to test different molecules against what's going to happen to the body, let alone to animals than the human body. But that's so interesting. And it's very rare for you to be able, that's a lot of, just a lot for you to take in and deal with. How do you juggle everything?
Very patient family.
Yeah. And I feel like when you're passionate about things, you find the time and you try to make it work. But man, that is what happens after the clinical trial.
Then you got to find somebody to market it and sell it with you. So if you can prove that it's safe and you get it to a phase 3 clinical trial, which is an efficacy trial, that's where you would partner with a device manufacturer or big pharma to have a multi-center trial. So then you're looking at a very heterogeneous group of patients and you're making sure it works in different genders, races, ages, et cetera, and it's safe across all those different players. And look, there's a lot of interest in this because people that want to avoid surgery are looking for these regenerative approaches to dealing with musculoskeletal disease. And the biggest issue that I have is that so many patients come to me because they know about the research that I do, and they want some kind of quote unquote stem cell therapy. But the things that are being done right now that are called stem cell therapy are very primitive. So I don't know if you have a lot of patients that talk to you about this or ask you about it. But if you go to a clinic, a stem cell clinic now in the US for stem cell therapy, they're going to do one of 3 things. They're either going to use allogeneic stem cells, which are cadaver cells that are frozen, and then they thaw them, put them in some gamish, and then inject them into a joint. So you can imagine the biologic activity of those cells is very limited. And who knows what, contaminants are in that. So we don't, advocate that. And the FDA is actually taking a pretty hard stance on trying to crack down on the use of cells for that. It's called a non-autologous use application. So basically, if you're going to use stem cells, they need to come from the same tissue and have the same application they would in your normal biology. And that's not what a lot of these are being used for. Or they're going to take fat from your abdomen via liposuction and try to isolate stem cells from that, or bone marrow. And those are both pretty invasive procedures.
Yes.
And they have no regenerative capacity. So those things will not make new cartilage or bone or ligament. They just act as anti-inflammatory units, and they're pretty good at that. So they will help with pain. They're not going to grow anything back.
And for how invasive it is.
Oh my goodness. Yeah. And then for the cost.
Yeah. Oh yeah.
They tens of thousands of dollars. So that's where the real ethical breach is from my perspective, is that to charge that much for something that has no proven efficacy to regenerate any cartilage, but to even intimate to the patient that it might, is a little bit disingenuous. And it contaminates the work that we're doing, because we're really trying to push stem cell science forward.
Right.
And meanwhile, the FDA is cracking down on all these different clinics because they're using it in an unethical way.
Right.
So a lot of what I do when patients come in to talk to me about stem cell therapy is unwind everything that they've heard about this from their friends who had anecdotal success from having some stem cell injection done.
Because their friend said it was good, or
exactly.
Yes.
So I don't disparage the folks that are doing it, but I do give a lot of education about what to really expect from it. And I do tell them there is a beneficial effect. It is an anti-inflammatory. And if you're going to compare it to, say, steroid, it's probably better than that for sure, because it doesn't have the same catabolic effects, negative effects that steroids do on tissues. But I'd be a lot more enthusiastic about it if it was less expensive, and approved by the FDA, and that hurdle is going to be very hard to come over.
And even a protocol behind, preventative, not preventative, but preventative maintenance, basically, because you can't, if you're just providing, an anti-inflammatory, you're not fixing the actual problem. So whatever was causing the issue in the first place, you're going to have to address that. So I feel like in those situations, most of the time, people just address the stem cell issue and then that's it. They don't really go into the longevity point of it. But I think there needs to be education around that too, because not just like injecting muscle,
Yeah, I think I'm getting, one of the things that I probably am a little bit different than most surgeons in this regard is that I really do talk to patients about like how to avoid getting into these problems to begin with, whether it be, joint degeneration, muscle injury, et cetera. We talked a little bit about this before, but everyone wants quick fix now. And surgery can provide a fix in some cases. But even if you have surgery, you're going to need extensive physical therapy, rehab afterwards to optimize the outcome from that surgery. I usually tell patients what I do is like 10%, and everything that you do afterwards is like 90% in terms of your recovery. But a lot of times you can avoid surgical intervention just by either modifying the way that you're either working out or doing something that's causing pain. And you may have to come to grips with the fact that, yes, this one part of your sport that you love, you're going to have to give that up, because there's 90 other things that you can do to get either good aerobic exercise, strength training, et cetera, that aren't going to cause you pain and aren't going to require you to have a major surgery to try to do this thing. So like the classic thing in my practice will be somebody will come in and be like, all right, my shoulder is killing me. And I'm like, all right, so what do you do? Like, well, I play, pickleball like 7 days a week. And I'm like, oh, okay. Have you tried taking a break from pickleball? Like, well, I can't do that. Are you crazy? And I'm like, all right, so let's back this up. So you want to have a major shoulder surgery to fix a very small problem that does not bother you at all during the day
except
or
for
while you're
pickleball.
sleeping, but it does hurt when you play pickleball. We're not going to do that. We're going to temporarily, and I never tell people we're going to stop doing this forever. I'm like, let's take a pause and a break from this for a little bit.
Regroup.
And we're going to substitute it with some other activity that will be less traumatic to your shoulder or the knee or whatever it is. And we're going to do great physiotherapy and maybe mix that with alternative therapies. Like if you like deep tissue or Rolfing, I have somebody that does that. If you want a good chiro, we've got someone who does that. And I'll make the appropriate referrals. And then I try to be sensitive to whatever they want to take from an anti-inflammatory perspective. I usually will use very gentle COX-2 inhibitors, which are easier on your stomach. It's a once a day thing, but some people can't take them for medical reasons. Other people are just antithetical to any kind of Western medicine. So I'm like, all right, we're going to do turmeric. You're going to do cold plunge or heat application or contrast therapy.
Right.
And, between the combination of activity modification, the anti-inflammatories, some good overall holistic therapy, as a surgeon, I shouldn't say this, but 8 or 9 out of 10 people are going to get through that problem without surgery.
Right.
And then you see them on the other end and you're like, how do I optimize you after that and make sure you don't get into the same issue, right?
Because they were going to have the surgery and then go right back to the mechanics they were playing pickleball in the first place.
So how do you reset their expectations about what their recovery is going to be like, after a big surgery or after an intervention so they don't go down that road again?
So it's funny because with the pro athletes and things, being a girl, it's so easy because I've rehabbed myself to the point where I'm very strong.
Mm-hmm.
And so, I remember the first day in NASCAR, I was like, I did the strength and conditioning too. So I did all the workouts and they were like, it was like 6 teams of 6 guys sitting there. And I'm like, you have to do this, this, and this. Why should we? Let's see you do it. And I was like, this is the moment. Like I have to lay it on the line. Otherwise they're going to take advantage of me the rest of my life. And I was like, first of all, I don't lift bitch weight. I'm like, I need to go get my weight. And then I did it. And they were like, we'll do whatever you say, because their weight was half of what mine was and they couldn't even lift it. So it's just creating this understanding. One, I tell them, ego out the door. I'm going to make you feel like a little weakling with everything you do. Because when you're training motor control, I'm going to train things you're not good at, that your brain does not fire to regularly, in a regular pattern. Your brain just gets comfortable firing in one way and it just stays with that way until you give it a stimuli to go a different route. And so I barely move some of these guys and they can't do the exercise. And they look at the table like I'm trying to trick them or something, or the weight, it's like 2 pounds. I'm like, no, that's you that can't lift that.
Right.
Or I make it pink depending on how bad the ego is. And so I try to break down their walls and create this understanding that you're not a superhuman. Mm-hmm. You can be if you want to work on your weaknesses, but you're in balance and you only training your strengths is what got you here in the first place. So I really make them aware of what's going on. And education, just like you said, education is huge with me. Mm-hmm. And by the end, my people are like, isn't their form the wrong form? I'm like, oh, yes, that's good. Like they look at other trainers and they're like, are they doing that wrong? So I like to educate people. And I say, I want to make it to where you don't need me. And I'm like, they never want to leave. But I'm like, you don't need me. It's in you. I'm just giving you the tools to help yourself. So.
Yeah, I think that's the other thing that patients don't they don't understand is that whether it's a physical therapist or a chiropractor or any other kind of health professional who's working on form and function and strengthening, going to the gym is not going to solve your problem. You need to condition small muscle groups that you've probably never worked on before to unwind a lot of the issues that you've caused by over strengthening major muscle groups. And that's one of the things that physical therapists are so good at. They can look at where are these weak small muscles that you need.
They didn't know existed.
That probably evolutionarily played some really big role in running away from like a lion
predator
or something. But we don't really use it anymore because we're sitting at a desk all day.
Right.
So good physical therapists will do that. And once you have some objective metrics, so the one thing we love to do with the players is get baseline testing on, every parameter you could imagine, range of motion of every joint, strength of all the muscles, but isokinetic testing, not just like, how much, can you bench press? It's like, what is your power like in these different areas? And then we look at deficiencies, we try to correlate them to injuries that we see throughout the season. And when they do have injuries, how can you get them back to a symmetrical and better state than they were before they got injured? So giving them the objective measurements gives them a goal to shoot for. What we're still trying to figure out is what the optimal measures are for each person, because they're probably different for every individual. And if you're looking at a professional sports team for different positions, some guys in hockey are on the ice longer, some are shorter, take shorter shifts, different roles and responsibilities a little bit. And we're not sure exactly how the data that we're collecting correlates to their recovery just yet, but it's still good to have some objective measures for
100%. And you can
shoot
correlate.
for.
I saw in NASCAR too, because we had a lot of tech guys that came in and we integrated a lot of technology in what we were doing, even sensors and weights and everything. And, we didn't really know what we were doing with all the information, but you start to correlate things and you start to understand what's going on in a fashion where you can use it as motivation, but you can use it to change issues that you're seeing. So we took the guys to Peak Performance Project in Santa Barbara, and they have force plates in the floor, and it even shows you weight shifting and the difference between that. You guys have force plates?
At Myers, yeah,
I love
absolutely,
that.
yeah.
I would love to come check out your facility. But and you guys, the partnership, I say your facility, but yes, the partnership facility. But that is so interesting to me because that is a newer aspect of sports performance because we didn't always have this information. So I just remember thinking, we would look at all the data with all of our guys and we're like, we don't know what this means, but it's so interesting.
Yeah.
And return to sport, you can see when someone still favors their legs. So psychological aspects of sport play a huge role in what I do. Just like teaching the guy what's going on and making sure that they know they're safe again so their brain can return to sport.
Well, it's just like if you're trying to learn a new task, whatever it is, you have to have someone show you what you're doing wrong. And you can do that with video. You can do that with force plates. You can use a combination of all those factors so that when you're trying to form a new pattern, you can get some visual feedback on what you're doing, right? Because it's like practice doesn't make perfect. It just is permanent. So you have to make sure that what you're practicing is correct.
Correct. Yes. Otherwise, you're training. I tell everyone, you're training against me 17 hours of the day. Give me a chance here.
Yeah.
So incorporating the lifestyle factors too, I make people aware of. You're sitting in hip flexion for this 6 hours. I'm gonna if those were workouts, how many hours a day are you working against what we're trying to do here?
Right.
So making people aware of that. So you think you're doing something correctly when your body has a pattern, especially from a trauma, you could be completely lopsided and you think you're straight up and down. So video therapy and mirror therapy really helps people because you think you're doing it right, but I use a lot of tactile awareness. So, teaching the guys, I'll poke and be like, you need to do this. So then you see them outside, like doing what you say to do. And they're like poking each other, making sure that they're, because in order to learn a new skill and create a new pattern, it requires a lot of correct repetitions, like you were saying. So it's interesting to see that you think one way and then you see yourself and you're like, I thought I was moving differently. So I think breaking that down and making them understand that there's inconsistency between how they move and, what they think they're doing, that helps break them down enough to help them grow and move forward in it.
And you also have to be able to give them the right cues.
Yes.
So I think being able to verbalize what you want them to perform physically is difficult to do. And even you can show them, but if you're very good at training, you can provide these like keywords that seem to work pretty well.
She knows because it's insane. People don't know what you're saying.
Yeah.
And your body's foreign at that time. You don't understand how to move the joint correctly. So you don't know. So the deer in headlight look that I have seen over the years from hundreds of thousands of patients where I say certain things and they don't get it. Yeah. Or if you speak too scientifically to someone where they don't understand the pelvis and you overwhelm them. So external cues and just giving them one big thing and not overwhelming them with 18 little things that they're not, because that fatigues you neurally. You're drained by the end of it. You need a nap and people can't do anything the rest of the day.
Yeah, and a lot of times these patients are in pain too, right?
Yes.
So you add that as a whole nother factor and they're trying to process what you're telling them, but they're in pain. So, the other piece of advice I usually give patients in their rehab is like, look, you're going to have this first few weeks is going to be hell right after surgery. So that's just time to let soft tissue heal. Don't feel like you got to be in rehab right away. Or if you are, it should be very restorative, right? A little bit of soft tissue, some gentle mobilization, et cetera. And then once you're over that very inflammatory phase, you can start working. And within that rehab space, you're going to experience pain, but it should never be like level 10 pain. It's 0 to 3, maybe 4. When it's more than that, you got to verbalize that to the therapist. You got to let them know because it's counterproductive, right? Now you're inducing inflammation, you're causing pain that's not providing any strength because you're inhibiting the muscles around the joint. So everything needs to be done within a, modestly pain tolerant
And everyone's different.
scope.
So
Yep.
you have to do it individually.
And people recover tremendously differently as
100%.
well. And I tell my patients there's no strict timeline. This information that I give your therapist is a framework. I'm like,
Generalized.
the therapist is an artist. They've got to work with you. And if I give them some dogmatic, like week 6, you've got to be 120 degrees, like that doesn't work for anybody.
Right.
So the therapist, a good one, they've gone to school. They know how to help a patient depending on how severe the injury is or the surgery, like how to get them through. And they know they're going to be outliers. And if there's a significant outlier, I need to hear about that. But everyone else, you just kind of work them as you provide them what they need at each time point. And I think if you tell patients, like everyone's different, and you're going to see some of your friends are going to be running at like 4 weeks, you are probably not going to be doing that. You might be, but that's probably not in the cards for you. At least they understand what the recovery is going to be like.
Right.
And a lot of the issues that I've seen between the practitioner and the patient come like anything else in life between bad communication, right? So if there's something was not communicated to them, like a potential outcome from the surgery, then they are going to be disappointed. But if they know that this is normal, this is as good as it's going to get, or it's not, then it just helps them plan a little bit.
There's comfort behind it. And the whole emotional aspect of it, especially these pro guys where this is their life, this is their chance. If they get hurt and then they're thinking in their head, oh, I can't play the rest of my life. How am I going to feed my family? You know, I've seen people go fully depressed and then they get on depression medication and it's just it's a recipe for disaster because it's hard to get people out of that. But that education and them trusting you and trusting that you have their best interest at heart is what keeps them going. I really see that. They're like little babies. You gotta coddle.
Yeah, and that's at every level.
Yes.
Right now in collegiate athletics, there's like an epidemic of anxiety and depression surrounding, just school in general. I think that's a little bit of a holdover from pandemic, but especially with our athletes, their whole existence has been focused on a sport, right? So if they haven't, first of all, they get to college and they've gone from being number one in their small town, wherever they came from, and now they're like buried in the depth chart at USC, right, or something. So there's anxiety surrounding that, and then they get an injury. Now their whole identity is dissociated from their existence because, like, oh, I'm a football player, or I'm a lacrosse player, and now I'm hurt. And, unfortunately, I won't say this is the case at USC, but at a lot of places, like the coach, if you're injured, they don't even like bother with you. The great ones who are good people will take care of their players, but in a lot of cases, if you're injured, they don't want to know what's going on with you. And as a doctor, you got to help the athlete not only get over their injury, but get through the psychological part of dealing with
navigating.
Yeah, being dissociated from their sport and their group, their buddies, everything. They're kind of like on the outside. So a lot of what we do, first of all, we get them into, I wouldn't say counseling, but they see a mental health specialist, especially if they're struggling, off the bat. But we try to keep them involved with their sport as much as possible. So like if you're a tennis player and you can't sprint, we'll still have you hitting like on a chair. So they're always doing something.
They feel involved
to stay involved with their team. And that it helps them maintain their identity.
Yes. That's huge. The fact that you even consider these things makes me so happy. So how we met, you can explain it because I'm interested to hear your side of like what you saw, like seeing from the inside that there was a difference in one of my patients. I just think it's fascinating.
Well, yeah. So we had a mutual patient that had an injury that I took care of them for, and he was like, "Oh, you have to meet my therapist, like who's taking care of me." And I was like, "Okay, great," because I was like, "You're doing fantastic." He had like a couple of weeks after surgery, like full range of motion. He had a shoulder surgery, and I was like, "Well, whatever they're doing is right." So we got invited to a premiere for a movie, and we got to meet each other there. And he had actually like invited people who were involved in his well-being to this party, and we got to sit down and talk for a
Because he
while.
cares about people.
Oh,
People are
incredible.
everything to him. He's such a good person.
And I mean, I love your philosophy. I like this idea of really like pushing people, but appropriately,
Yes.
and mobilizing them and
Yes.
making sure that they are getting not just physical therapy, but mental therapy as well, you know?
And he said too that you saw from the inside that the bone didn't move.
Mm-hmm.
So before you fixed it, going internally, what did you see? Because he's older than most of your Kings athletes, and I know he said that you had a guy that had a similar injury that healed. It took him a few more months to heal than this patient did. Correct?
Yeah, I mean, he had a pretty severe fracture, but we got really good immobilization of it, and I think by fixing that fracture in a way that he was going to be able to go back sooner rather than later, and waiting for it to heal without surgery. I mean, he's obviously a pretty high intensity kind of guy,
nonstop.
and we got rigid fixation, and then once we handed him off, I mean, he was able to start rehabbing it pretty rapidly.
Right away. But even before that, so he was like, the doctor saw that the bone didn't move, like after it broke. Have you seen that before? That's what I was interested in talking to you about with that specific injury. It was that, I guess the clavicle, you've seen it stab the pec, go, tear the lung, or anything with trauma related to the bone moving, but his bones kind of stayed in place.
Right. No, it was displaced, but there wasn't a lot of soft tissue trauma around it. It was short enough that it definitely needed to be fixed.
For sure.
But it was not, the trapezius muscle and the muscle around the clavicle was fine. So I think that's part of the reason that he recovered pretty rapidly. Because once the bone was fixed, it was pretty easy to move him along.
And if your tissue is not traumatized, your motor control is efficient, and your body's not in balance, the circulation, even the lymph system works more efficiently. Even I've seen with digestion, people are all clamped down. They're sitting at chairs all day and like, I haven't gone to the bathroom in like 4 days. I'm like, what? Like, what is wrong? Like, this is not a good thing. And so we work and we open up the stomach and they'll go within 10 minutes. And so it's so funny because a lot of my celebrities, I'm like, I can make you. And they're like, you're such a weirdo. I was like, I do lots of things. But it's all the human body, and what does the body need to be healthy, to be successful? So you set them up for success. And that's how a lot of my patients, when their motor control is efficient, they heal quicker. Things don't bother them. My one patient broke her back, fell off a horse, should literally be paralyzed. The doctors are all like, we don't understand, like completely bursted one of her vertebrae. And then recently was like, fell down the stairs. I was like, after the back break, like, you can't calm down. And she's like, I slipped and I fell. And even though there was a burst fracture, she's still perfectly fine. And before would like turn her head and be injured. And we've just built her to the point where, like, even before the fall, she fell down the stairs and she's like, I fell down the stairs and nothing's wrong. And she like kept like pacing back and forth. She's like, I don't understand how this is possible. She's like, the vase broke into 70 pieces. One time she got up out of the table and looked at her daughter, and her neck was messed up for 2 weeks.
Oh my goodness.
So to be able to, she like was dumbfounded. She's like, I fell down the stairs, the steep stairs. And I'm like, you're coordinated.
So in addition to, the sort of like retraining that you do for like coordination, strength, et cetera, do you ever, this is a question I get all the time from patients, do you recommend any kind of supplements? Like, are there things that you really believe in that either help build muscle mass, maybe help with nutrition, immunity, et cetera? Because I have my own thoughts about it, but I would be interested to hear what your current thinking is.
So I do everything by the book as far as individually. You can't just generalize that, I'm like, I don't know. I'm not a mind reader. People are like, you need this supplement. Are they deficient in that? How do you know that?
Right.
I work with different companies where they take blood work and we
functional tests.
Yes. And we look at what inflames your body, what, what's going on internally. What are you deficient in? Micronutrients, and looking at things from a basic foundational level, because everything on top of that is going to be inefficient if you're not paying attention to that. So I do everything through looking at what inflames your body, where your blood is right now, having a baseline there, and then working with just, pesticides. I don't know how far into just how unhealthy our society is, but just the pesticide, all the things that
pretty unhealthy.
It's crazy. So just what can make the biggest difference in their life? So, catering towards more USDA and things that are looked at as far as quality in how the animals are raised, if you're going to eat meat. So things like that. But I never make recommendations unless I can see internally what's going on with their body.
Yeah, I really, we had talked a little bit about like foundationally what would I have changed if I was looking at my younger self about
Yeah.
things. Two major areas. One, I would have been much more careful about what I consume because, the habits are kind of set now. And I do try to be very careful about um, eating, like if it's going to be meat, it's from a reputable
Yes.
source, organic, quote unquote, organic vegetables, but really just trying to eat more cleanly.
Yes.
Than
Whole
I,
foods. That's my
yeah,
number one
then
thing is
like
real food.
keeping the processed stuff
Yes.
out as much as possible.
Yes.
I will indulge a good Velveeta cheesesteak every, once in a while, but not very
Pick your battles is
frequently.
what I say.
And then
Mine's double stuffed Oreos.
the other area that I think I would have loved, I wish that I just knew this growing up, was just cross training and like not being, like growing up as a football player on the East Coast, it was just like strength training, just trying to bench as much as you could, squat as much, like these completely non-functional exercises. And what we've tried to instill on our kids is like exercise should be, first of all, it should be fun, but it should be a bunch of different
Ever
things. And
changing.
yes, you may want to do some powerlifting, but you should be doing a lot of flexibility.
Mhm.
You should be doing a ton of like interval cardio where your heart rate's up and then back down and then up and down. And the sports that you do can reflect that. So, like, if you're out in the water surfing, you have to paddle for a wave, your heart rate's going to go way up and then it's going to come back down when you're relaxing a little bit. And not doing one thing so much that you get into an injury pattern.
Right.
And that's the other thing I try to emphasize with my patients. Like, if they love to run, but they've got debilitating anterior knee pain, like, all right, running
Calm it
is not
down.
right now.
Right.
Running is not your thing, but swimming may be your thing and cycling may be your thing. And there's a lot of other things that you can do that are going to get your heart rate up that aren't going to cause you like 11
Damage.
out of 10 pain. So let's figure out what we can do to make you better. And then you slowly introduce sports that they may not have had any interest in that they're now really excited about. So I think that substitution thing is really important. But from a young age, learning that you have to be a multi sport, multi training kind of athlete, I think is really important. And I think that's how you avoid injury too.
100%.
Because it's in the end, it's really about not the intensity is important, but it's really about longevity. Like if you can't do your thing because you've injured yourself, then you're out of it for too long, right?
Right.
Like if you like to lift weights and do that for strengthening and conditioning, that's great. But if you're always trying to do max rep and then you you get injured, now you're out of that workout routine for months, right? So you want to avoid injury to a point where you can get the benefit of the exercise, but not injure yourself doing it and you take it away from yourself. That all comes down to a counseling issue as well.
Yes.
And even when you're recovering from a surgery, it's like, I know our goal. And I always ask the patient, what's your goal? Like, what do you want to get back to doing? It's X. All right. This is how long I think it might take. Again, without giving you a specific timeline. If you really want to push it, you may get there faster, but you also may get hurt getting back to your sport. And then you're going to delay this recovery for an even longer time.
Yeah.
Exactly.
And all the research on just stimulating the brain in different ways, different patterns, especially with kids and not being
Mhm.
involved in just one sport. I always tell everyone the brain is a lazy con artist. It's just trying to figure out the path of least.
Mhm.
And so as soon as you look away, it's going to be sloppy and, slop to one side unless you're conscious of it. So just trying to always change up different activities. We're doing yoga, hot yoga, this, that, I love powerlifting. I love lifting heavy.
Mhm.
And I just lifted but it's fun for me because when you work on the foundational things, you can be strong. I wasn't always strong. I had injuries before, small injuries, but when you work on the foundation of your body and your movement mechanics, how you can transfer load and your force transfer, it's unbelievable what you can do and how strong you can get without creating inflammation
Mhm.
and without setting yourself back.
Right.
So I'm always like, all right, what else can I do? I don't like that. Why is there resistance there? Let's explore it and let's dive right into it basically because I love challenging myself in every way that I can and then
Mhm.
figuring my way out basically. So you answered both the questions and then the advice that you would give and then there was one other Younger self. Oh, the number one behavior change that you think will lead to the biggest change in someone's life. It could be
Uh,
from young that you know or that you've seen with your athletes.
well, I think there's two things that I think are critical, and this is very, I think, like mainstream now, but I do think it's critical is good sleep. Because I think without that foundation of sleep, and I'm the wrong person to ask because I'm never sleeping
That's why I forgot my
appropriately.
my thought. I'm like,
Um,
sleep.
but that I've been working on it,
Yes.
and I think that um, having tremendous sleep hygiene is really important because it's the foundation of maintaining healthy cortisol levels, which affect your weight and energy levels and your mood. So I think that is critical. And I think that the more emphasis that's put on obtaining good sleep and restoring, your mental and physical energy during that time period, just having downtime
Yep.
is really important. Like there are times when my wife looks at me and I'll just be sitting on the couch, like literally doing nothing, like either meditating or just sitting there. So what are you doing? I'm like, nothing. I'm not doing anything right now.
Just
Having
by
this
heaven.
having this downtime to not be looking at a device, not even reading per se or
Yes.
something. It's just like the mindfulness thing is very important. And that ties into sleep because I think if you're so revved up during the day, you're not going to be able to sleep well. So you have to figure some kind of mindfulness practice into your day. Um, and and then just exercise, whatever it is. I mean, again, it sounds ridiculous. Like, yeah, you should exercise, but when human beings are exercising and you're getting that adrenaline rush that you get from it and the
Yeah.
pushing your sympathetic system up and then bringing back down into recovery, that's what we were meant to do as organisms. It's like that evolutionary drive to have high ups and downs that eventually bring the baseline down a little bit lower in terms of your overall
Tolerance.
anxiety level. So those two things, if you're sleeping well and you're exercising, that's generally only good things can come out of that. Nutrition is important, but if you're gonna rank them,
Yes.
I'd say the sleep and exercise are like 1 and 2, and the nutrition is 3.
Yeah.
And it's just hard in the US to do that because the emphasis here is on work, grind, and, like, how much more can you do? And it shouldn't be like that. And
No.
I think I've come to that realization now at, like, I'm 47, and when COVID had a little bit to do with it, but I was already feeling like, "Oh my, I gotta slow this down. Like, I can't be running on all 8 cylinders all the time." And it's really become focus, of my well-being now is I love my work, love seeing patients, but that's just one part of what I do. And my kids are of, like, high school, middle school age, so spending time with them and my wife where we're doing these sometimes athletic things together, sometimes just spending time hanging out. That's critical part of my life. And then exercise, sleep, and these things that make you feel good and provide, the like mental sanity kind of portion to things. So,
That all makes up your health.
yeah,
And time goes by so quickly and we look back and I'm like, oh my gosh, I haven't taken a day off and how long it takes away from who you are and then you can't
yeah.
deliver.
I think that's a product. I mean, it's a global issue, but it's
Yes.
particularly bad in the U.S. where
100%.
we are like grinding all the time.
Mm.
Um, in Europe, I mean, you get 8 weeks of vacation as a given. Like, it's not like people don't expect you to be working in July. It's like,
During lunch, the
"What are you
Greeks, they
doing?"
shut down from like 12
So,
to 4. It's
I
break
know
time.
it's not realistic to think that that's gonna happen in the US tomorrow, but I think in the future, to see our society shift a little bit more of a way where you are
We're conscious of this.
mindful of this need to just be human and
Right.
relax.
And you're gonna be better for it in the long run anyways, because
Mhm.
you're basically burning the candle from both ends when you're just constantly going. And the quality of your thoughts, your everything are different. So education, I think, is huge because the corporate company's telling us to work, and buy, but we just have to
but also
educate.
Think of how much more you could accomplish if you had time each day to simply, and I don't know if this is the right word, but philosophize, like just think about things, write down stuff in your book, think about big problems. Like if you're always focused on a goal instead of just like pondering things, you're not going to discover anything new.
No.
You know?
And I just think about us as an organism, like you said, when we're always going, your field of vision narrows, you're always focused on that next thing. Like you can't see clearly. Your field of vision is just limited to wherever the threat is at that moment. So there's a lot of thoughts and memories and so many things that you're missing out on because you can't even access them while you're in that state. So I feel like stepping back really helps people move forward. So I love that.
Time to philosophize.
Right? And for sanity for other people too, like for yourself, for other people. I love it. Well, I appreciate you so much.
No, I'm honored and grateful for the invite. So thanks for having me.
I would love to learn more about your research and just even come check out the facility. It'd be
you got to come down and check out.
I love that kind of stuff.
MIS and Toyota Center and watch a practice.
Definitely.
Come to a game.
Yeah. So Kelly and Lance invited me to a game, so I'll take him up on that. That'd be funny. He's there like behind us. And I'm like, hey guys. So yeah, I'm in. And I'd love to talk to one of the players too. I haven't seen one of them in a long time. So Kelly wanted me to work with she's like, you need to come do our whole PT. And I was like, listen, I'm one person. I need my downtime.
Oh, I think it'd be fun for you to meet with John and Lisa too, because they're awesome. They're just very thoughtful and really warm, and the players love them, and they've helped me out tremendously. So
I love that. And I feel like that's what makes a good practitioner is you care about people because people are the number one thing that drive what we do in the medical field. So I think it's so important to always remember that money will come if you're taking care of people. So yeah, I'm excited to meet them because anyone that philosophizes like you is going to be amazing.
Yeah.
Also,
it's all basic, right? Take care of the patient. That's it.
And you think it's not that hard. Like the goal that you said was the patient's goal. Like I just stick to that. It seems simple, but for some people it's hard. And anything as far as anything you want to plug, any website or just the facility in general, or where people can find more information about you, anything that you would like to give.
Yeah. So if you want more information on the research we're doing and on the practice, it's www.drpetrigliano.com, drfrankpetrigliano.com. And we're in El Segundo at the Toyota Center, which is King's Practice facility. And we have offices in Beverly Hills, downtown LA, and Santa Clarita. So I see patients throughout LA. And yeah, that's it. You know, if you've got a sports injury, USC Sports Medicine, it's a place to go.
Amazing. And how often are you at the facility?
Twice a week.
Okay, perfect. What days?
Tuesdays and Thursdays.
Okay, perfect. Thank you so much for joining us. We hope you enjoyed this episode. Make sure to like and subscribe and leave a comment if you have any questions, and we'll see you next time.